Hey guys, this is Connor with Conquest HP. This is going to be a video about the basics of shoulder pain management. I did a video like this for back pain management, low back pain management, and some people were asking for a shoulder video. So here are some basics that you can kind of stick to if you're in pain right now, if you've just injured yourself. These are very, very basic techniques just to kind of get control over your passive and active ranges of motion, maybe get your pain under control, and maybe get you back to doing something a bit more exciting, or maybe just furthering your recovery and your therapy. So first things first, you want to make sure that you are kind of pain-free in your basic standing shoulder position. So if I'm just in a kneeling position here, you can do it seated as well. I should be able to just lay my hands at my sides and let my arms hang without pain. If you can't do that, if there's shoulder pain right away, I would advise you to kind of play with your shoulder position. It's very likely that if your shoulder is in pain already, that your shoulder is going to be tucked in, or one will be tucked in. This is just a go-to compensation pattern that you'll see with a lot of shoulder impingement problems. So really try to crank those shoulder blades back and down a little bit. Think about puffing out your chest. That'll really get those shoulder blades back and down. And then sit there and see if you can do that without pain. If you can do that without pain, then that's awesome. That's a good starting point. You got to start somewhere, right? If not, you're going to have to really practice your breathing even in this basic position. Try to tell that nervous system that everything's okay. So just get the palms facing towards the body, let everything relax, get those shoulder blades down and back, puff the chest out, and then focus on breathing as in 3 to 4 seconds inhalations and 5 to 7 seconds out. So you're going to want to work with sets of probably 3 to 5 reps on those. Really focus on that exhalation. Hopefully that can help those tissues relax. Maybe it'll help to desensitize that pain a little bit right off the bat. But you've got to get control of that basic standing position before you go anywhere else. After you've done that, then you can work on some basic internal, external rotation in this position. So again, just hanging my arms at my sides, get those shoulder blades down and back, then turn your palms to face forward, and then turn your palms to face as far back as possible. So I'm working a really limited internal and external range of motion here, but in doing so, I'm getting the humerus kind of rotating in the glenohumeral joint. So hopefully I can grease those joint tissues a little bit. Maybe I can gain some mobility by doing that. Demonstrate that part should maybe not be in pain. So you're going to want to perform that for reps, and obviously it's not loaded or anything, but if you have no pain in that range of motion, you can kind of try to push the range of motion on each rep, try to get as far as you can briefly, and then switch directions. So maybe sets of 15 to 20 reps, that kind of thing. If you are finding pain, you're going to want to back off that range of motion, so don't engage the painful range of motion. Just go to the edge of the painful range of motion, and then just kind of do your deep breathing there. Then just do your deep breathing there. So I would, again, just stick to 3 to 5 reps of the deep breathing, and then try to see if you can push that range of motion a little bit further. So you want to get control of that basic range of motion first. After you've done that, you can take this to quadruped position, which is, again, kneeling, but now I've got my knees beneath my hips and my hands beneath my shoulders. And while you're doing this with shoulder pain, you're going to want to get as much weight on your hips as possible. So normally I could pop my knees off the ground, and that would load the shoulders quite a bit. We don't want to do that just yet. So lots of weight back here. And if you're in pain, just in this position, walk the hands back towards the knees a little bit. That essentially changes it from this shoulder position to this shoulder position. It should be safer. But whatever you can manage there, what you're going to want to do is just contract the core as though someone's going to hit you in the stomach, and then just kind of rock the hips back and forth. So again, I'm just barely moving my arm through a basic range of motion. It's not really loaded, but I can do lots of reps here that'll hopefully grease that joint a little bit and give me some range of motion back. If you you have no pain in that range of motion, that's great. Start to work your hands further forward so that when you sit back, you're essentially getting into a full overhead range of motion, like a full overhead position, which is a really good sign if you can tolerate that. If you can't tolerate that without pain, again, same idea. Just go to the edge of that range of motion where you normally feel your pain. Do not engage the pain. And you can hang out in that stretched position where you are feeling where you're about to feel some pain, and then do your deep breathing there, and then try to push it a little bit further afterwards. After you've done that passively, then you can get it a bit more active. So after you've done quite a few reps just to grease the joint, then I'm going to start pushing my hands down into the floor hard. So as though I'm trying to crush the floor, and then the same thing. I'm just going to rock back and forth. And that'll just activate the rotator cuff, that'll activate the lats and the triceps, help me stabilize that shoulder joint a little bit. And then same thing, just do it for reps. Nothing too fancy there. If you are feeling really good doing that full range of motion right off the bat, that's awesome. And then you can take the knees off the ground and just kind of work through a squatting range of motion, which will give you a little bit of load on the arms and on the shoulders, a little bit more load than you were getting with the other variations. So if you can tolerate all of that, then you can also work on scapular movement. So basic scapular movement in this kneeling position would just be me able to shrug and then reverse shrug. So pull my shoulders up to my ears and then yank my shoulder blades as far down as possible. You're going to want to be able to go both ways. Most people are going to have trouble getting those shoulder blades down the back, and if that's you, you're going to want to work on it. Same idea. Push that range of motion, lots of reps, don't engage pain, and when you do find a restriction or pain or your range of motion isn't adequate, then you're going to want to stick to that end range that you can control and do your deep breathing there. After you've done that, you can get back into quadruped and then work on some scapular shrugs from this position. So I'm just going to press my hands into the floor, which really shoves my shoulder blade to the outside of my rib cage. So push hands into the floor and then let my chest sink towards the floor. So hands into the floor and then chest to floor. Hands into the floor, chest into the floor. And same idea. If you're in pain, if you're restricted there, breathe through it, do lots of reps in the range of motion you can control, and then come back and reassess that range of motion. See if you can get a little bit further. So the goal with these drills is to get you to kind of a comfortable full overhead position, get you comfortable with loading the shoulder and the scapula through scapular shrugs and the overhead position again, and then just have pain control through that range of motion just by using the breathing to kind of manage the positions, make sure the tissue tension isn't off the charts while you're doing it, make sure you can relax in those positions. And you can do the same thing with the chair out to the side as well. So if I just grab a chair and I can stand next to it, you can do this with anything obviously that you can set your hand on. If I just stand next to a chair and this is a pretty pain-free range of motion, and I start to lean away from it, what I'm essentially doing is lifting my arm out to the side. But because the chair is here and I'm moving my body away, it's a passive range of motion. So I can just kind of slide my hips away, and I'm getting closer and closer to that 90-degree abduction kind of point, which is like a big milestone for most people. So I want to just kind of ease into it. Don't make it painful. Just lots of reps in your comfortable range of motion. Go to that at the end of that range of motion and then do some breathing there and see if you can expand it further. After that, make it active by pushing down into the object and then going into that rocking motion again. But again, do not make it painful on yourself. There's no point at this point to further sensitize already pissed off tissues, and it's probably just going to push your recovery back a little bit further. So try to avoid pain if you can. Between those drills, you're going to take care of kind of raising the shoulder to the front, raising it out to the side, a little bit of internal and external rotation, and hopefully that gets rid of some of that pain sensitivity that you've been dealing with. After that, you can look at my pressing warm-up video, and I have some more shoulder drills in there. But I'd love to hear some feedback from any of you. If you have shoulder pain or shoulder injuries, I'd love to know if there's something else that I can cover for you. Thanks.